Grace and peace be unto you, and peace from God, our holy parent. This is the day that the Lord has made, and we are rejoicing and glad to be in it. We today are gathered to talk about the effects of COVID-19 on people of African descent. This particular webinar town hall is sponsored by the African Descent Lutheran Association of the Evangelical Lutheran Church in America, and I'm Pastor Lamont Anthony Wells, and I serve as the national president of the African Descent Lutheran Association. And on today's webinar, we have with us Dr. Ulysses Burley, Pastor Tiffany Cheney, and Pastor Amsalu Gileta. And we're going to start sharing. A few weeks ago, we put together a survey that went out to many participants of ADLA and other members of congregations and supporters of ADLA. And some of the things that we began to find and talk about would be helpful for many of us to understand about how we are facing this particular pandemic. I'm reminded of a couple of things that Martin Luther said concerning pandemics, and he talked a little bit about fears. He gave two responses, if you will. He urged faith. And this is something that you'll see particularly in the evidence of the survey, that we as people of African descent have exerted historically an enormous amount of faith of knowing that the Lord will make a way somehow. And he also counseled, Luther also counseled that Christians should use reason and follow medical advice. And that's why we have individuals on this call that are going to give us some information to help us to understand how we should deal with this. And in Luther's argument, he even talked about civil order as vital in times of plague. So we want to deal with the political aspects of how we as people of African descent are facing this pandemic in our personal homes, in our congregations, and in our own physical bodies. Pastor Cheney is going to lead us now in some preliminary remarks about what the survey looks like and some of the early responses to the survey. Pastor Cheney.
Thank you. With this survey, we reached out to ADLA members and other members of our community to be able to understand how they were being impacted by COVID-19. We, in our initial response, heard from 70 participants with every ADLA chapter represented. We received a strong representation from the Los Angeles chapter with 37% of respondents coming from this particular chapter. We have 13 synods from across the country represented. We have had a few additional respondents to come in the last few days since this data was collated who are not included here. So the survey remains open, but these are our first participants and we are able to hear some from them today. One of the first things we asked was, how are you doing and how is your family doing? 91%, the vast majority of our respondents said that they were either good or very good. Half of those, of course, said that they were very good. When we asked about their families, the same pattern is reflected in the response for family members. 90% said either good or very good. However, it's interesting that when asking about family members and loved ones, they were more likely to use good versus very good. Now, I think it's important when we look at this particular response to consider some important factors about this survey and how it might have impacted how people responded. First, we consider the timing of the survey significant. This survey was released during Holy Week about 4 weeks ago, and most of our respondents took it during that first week. This is significant because it was just about this time, it was that very week that we were starting to hear some of the national implications on people of African descent. We were starting to hear that Black people were disproportionately more impacted by COVID-19. Also, I think it's important to consider the lens of hope that is typically a cultural value for people of African descent, passed down from our ancestors, that even in the toughest of times, to look at life through a lens of hope that could be reflected here as well. And then also, we know that people of African descent are less likely to talk publicly about their problems, which could also play into this result. Next, we asked about personal faith. So respondents mostly said that their faith was growing. About 3/4 of our respondents said this, and the rest said that their faith was about the same. No one said their faith was declining or diminishing. When considering the well-being of the congregation, a little over 1/3 said that COVID-19 was impacting the well-being of their congregation a great deal, and another third said somewhat. 19% of our respondents indicated very little as to how the congregation was being impacted by COVID-19. We now have some time for some points of connection.
So, Dr. Burley, when I looked at this particular survey and I reviewed it, and knowing the different aspects of we as a people, we tend to be more positive again about various things. So there's something that if you ask me how I'm doing, immediately I'm going to say I'm good, or that this concept of that we're fine. I remember early on, late January and February, many of us were kind of making memes and joking that this particular virus is not affecting people of African descent. And there were no numbers, and there's still no major numbers to really help us to understand the critical nature of this. Until later in March, when we began to hear and see, and actually Holy Week was this year. Holy Week 2020 was one of the deadliest impacted years, or months rather, and weeks of the particular responses or reactions to the pandemic. And I live here in Harlem, New York, and so we're in the epicenter of a lot of this stuff. So what should we be concerned about, and why, and what we can do about it? What's this whole issue of the pandemic and how it relates to Black people? What do we need to do about it?
Sure. Well, first and foremost, it's promising to see that respondents were doing well, and that their families were doing well, at least at the time. But as Reverend Cheney pointed out, soon after we would learn that people of African descent were not doing well as it relates to the COVID-19 pandemic. Reverend Wells, you mentioned the positivity of Black folk. And I'm not sure it's as much as positivity as it is we have gotten accustomed to operating at a deficit. And so anything beyond our deficit seems like a good thing, a good time, a good point of reference. And so when I was in a clinical setting, I used to see people with asthma, people of descent with asthma. I used to lead clinical research studies. And they would come in and we would ask them how they were breathing. And they would say that they were breathing fine, but when we actually got the numbers, they were almost not breathing at all. Mm-hmm. And to the point to where we would have to send them to the emergency room right away, but they had gotten so accustomed to breathing at a deficit that that became their baseline. And so I think that's relevant information when we talk about the ways in which COVID-19 is now disproportionately impacting people of color, but that our response to it might not necessarily suggest as such. And as a result, it causes this system to then discard our actual status, our actual feelings, our actual state as it relates to healthcare. COVID-19 is a global pandemic. More than 3.5 million people have now been impacted worldwide. Here in the United States, we have now exceeded 1 million cases with over 68,000 deaths and more than 153,000 people who have recovered. We now know, as data still begins to come in, that probably 1/3 of the United States total COVID-19 cases are among people of African descent. And so that includes both deaths, hospitalizations, and transmissions. If you break it down to
reported numbers, right?
Reported numbers, exactly.
There are people that might have it, but that are at home and managing it themselves.
That's absolutely right. If you start to break those numbers down to our urban epicenters, particularly where Black people are most populous, Philadelphia, Milwaukee, Chicago, New Orleans, St. Louis, Detroit, All of these places at some point were reporting over 70% of their COVID-19 deaths were among people of African descent. And so we are not doing well. And let me first state that there is nothing about our Blackness that predisposes us to disease, including COVID-19. Likewise, there's nothing about our Blackness that makes us immune to diseases like COVID-19. However, there is something about our Blackness that predisposes us to racism and discrimination and bias. And as a result of that predisposition, we then become more vulnerable to diseases like COVID-19. And thus we have this overrepresentation of people of African descent in this current pandemic.
Wow. So, Pastor Amsalu, so take us to the motherland, take us to the continent of Africa, and so again, the numbers have been low. Some countries like Ghana have fully reopened with minimal casualties. How prepared and ready of a response did the many countries in the motherland or nations in the motherland have, to your knowledge?
To my knowledge, I think Ebola had prepared them really well because it impacted disproportionately some of African countries. So when disinformation was happening about COVID is not impacting Africans or African descent, the leaders took it really seriously, and there were contact tracing, quarantine, universities and hotels changed to quarantine places. Travelers, passengers had to be in the quarantine for 14 days, mandatory quarantine, before they actually move on. I think helped, but again, it is not over yet. So I don't want to be overly optimistic, but it seems there is preparation for it and it is working.
Okay, good. And so many people, this affects so many people, but people who are right on the front line, who can't get away from this, are first responders, right? And particularly disproportionately, many of our first responders, particularly in certain types of work, as essential workers, are people of African descent. Reverend Cheney, how are they affected, and how can we help, our aunties and our uncles and things who are nurses, and what can we do?
So I think when we think about first responders as it relates to COVID-19, that covers now many different kinds of industries. Grocery stores and banks and so on. I particularly served in a healthcare organization. As I think about it from the lens of a healthcare organization, what we can do is to listen to our public health officials as it relates to guidelines about social distancing, about using face coverings and so on. That the best thing we can do for our first responders is to stay out of the hospitals if we can from being sick and overrunning them, right? So the big narrative of COVID-19 from the beginning was trying to protect the surge of capacity within our ICUs. You've seen the graph, you've heard the language about flattening the curve. Flattening the curve is all about making sure that our healthcare organizations, that our hospitals are able to handle the capacity of patients that come. And what it also means is that for many of our healthcare workers personally, there are so many who are choosing to stay separate from their families in this time, if they can. Here in Montgomery, where I live and serve, we have a local college, Auburn University Montgomery, that has provided housing for healthcare workers who are afraid to go home with their families during this time because they don't want to be carriers of this virus to their families. My hope is that by us all working together as a community, by us all social distancing, using face coverings, making prudent decisions about how we engage together in community, we are able to allow this virus to work itself to the point where it's not such a burden on our healthcare systems, and so that our workers can go home comfortably and confidently and be with their families, that our hospitals and our emergency departments, our urgent care clinics and so on are able to trust that they can handle the demand of patients as they come, to listen to good advice that comes from our public health professionals and make smart decisions about how we engage during this time.
Good, thank you. So this period of quarantine for many of us feels like oppression, right? It's for some, right? Like we can't do the things that we want to do. We can't go the places that we want to go to. So for me, I've tried to reframe like what I do during this period of time to reevaluate myself and reevaluate my ministry. So I talk about the preparedness. Well, I'm an only child, so I was prepared because I've been home, by myself, as a latchkey child for many, many years. But our government, people are talking about, was not as prepared as it should have been or could have been, right? And there are various news reports, and I believe more will probably come out later about when our government leaders knew about this and what could have been done, the preparation for PPE and other things like that, those stockpiles and how those should have been made more readily available. Also with testing, that has to also increase, and we're not up to par with that. Forget a vaccine, we know that takes time to manifest. But I'm concerned as I look at this survey about the church's response to this. How prepared do you all think, just in your own gut, that the church was to this or for this? I look at some of our historically Black denominations like the AME Church. Dr. Miriam Burnett is their healthcare specialist and minister, and they were already prepared with white papers, if you will, that spoke to this. And to my knowledge, I've not seen any blue paper or white paper yet that really helped us as Lutherans to be prepared for this. They were prepared because they have relationships with countries and nations that already deal with pandemics like this. How prepared do you think we are, and what do you think surprised the church the most? Everybody.
I think one of the surprises, and we'll see this as we get into more of the results, is understanding what it means to gather when we can't gather in person, and understanding what it means to have nimble ministry. I've watched businesses that have flipped in this community to be able to serve the community differently. How nimble were we as a church to be able to think about what it means to serve when basically overnight, or certainly within a couple of days, we can no longer gather in the ways that we've been doing since ancient times.
So I think our people, community gathering in person is the center of life. Life is community, and community is life. And the church is the center of that community that binds the community together. So not to meet in person actually have an impact on all of our communities. In most cases, or in some cases, the church is the provider of all safety nets too. So for that purpose, I don't think the churches are prepared for the converting quickly to online services or virtual ministries. Although it doesn't require a whole lot. I mean, as long as we are flexible to do those. So that is what we are observing. There are some who are actually proactive and took advantage of and just use what they have to adapt. But still, that community in-person gathering is very important to us, or to people, to our people, that that has an impact in totality.
Dr. Burley, I'm concerned about, you and I have worked together with our HIV and AIDS initiatives in the ELCA and beyond. And I'm very concerned about the other side effects or reactions and things that will exacerbate because of COVID-19 and the whole quarantining and social distancing or the lack thereof. I'm hearing about parties everywhere, even up to freaknik proportions in some areas. And so I'm very concerned about other areas that you think are going to grow because of this. Like I hope this is not true, but I'm thinking that some sexually transmitted diseases. I've heard a friend of mine from Philadelphia who works in healthcare said there has been an uprise in syphilis cases this just in the last month or so. What do you think some of the other effects of COVID-19 will do for us regarding other areas of our health?
Right. So this is what we call the social determinants of health. And those are the structural conditions in which people are born, learn, grow, and live. And it includes their neighborhood environment, their economic stability, their level of education, their social contact, as well as their access to health and healthcare. And so not necessarily the effects of COVID-19 on our physical selves, but how does COVID-19 then affect structural systems that manifest as other forms of dis-ease, if you will. And so you mentioned people living with HIV and AIDS, which is my expertise. And so I've been a part of a lot of conversations around making sure that people living with HIV are not forgotten. As of right now, physicians, public health experts, scientists who would otherwise usually be working on the HIV and AIDS problem have had to shift for an all hands on deck type response for COVID-19. As a result, there are people who still need HIV and AIDS care who cannot otherwise receive that care as a result of that shift. And so then there becomes a question of access to much needed care, access to life sustaining treatment, access to even prophylactics, as you mentioned. And so you start to see other sexually transmitted infections increase, especially as people are confined to their homes. You know, that becomes a level of escape when you can't actually physically escape your setting. And so these definitely are consequences, and they're consequences that will impact people of African descent more because they were things that impacted us more already. So this just becomes a compounded effect. But even more than that, you know, we talk about our response right now. This is going to have ramifications beyond COVID-19. You know, we will get to a point where COVID-19 is history, where we have the science we need to stabilize and make COVID-19 a chronic disease that's manageable and treatable. But after that, there will be casualties. There will be families that are never the same. There will be people who have recovered, but their health as a result will never be the same. And it will require long-term care that they might not have access to. It will require a level of resources that aren't currently available. And so when we think about our African descent populations and our needs, not only right now, we have to be thinking about after the fact. The same way in which we have continued to consider victims of 9/11, the same way in which we have continued to consider victims of Hurricane Katrina, even when you begin to date back to, you know, workplace hazards like asbestos exposure. And after learning that there were certain kinds of people who had been exposed to this carcinogen, that they would then need a fund for the rest of their lives to not only sustain healthcare, but to compensate them for what we did not know then, what we know now. And my guess and understanding of this particular pandemic and the types of people that it is impacting, frontline workers, essential workers, which people of African descent are overrepresented in. Also industries that don't provide health care or paid leave or things of that nature will then need those kinds of resources long-term as a result of being disproportionately exposed to this virus. And so I think that begins to be a connection point for our churches in terms of advocacy.
Yes.
At the state and federal level, advocacy around policies, advocacy as it relates to the ongoing conversation around reparations, right? Reparations might look like medical benefits, right, in perpetuity as a result of people of African descent continuing to be overrepresented in these in all the worst categories as it relates to our physical health as a result of, and I always have to bring it back to systemic and systematic discrimination and racism.
And these are facts. So we're lifting this up, you know, and I wrote an article a couple of weeks ago, and I start talking about the disproportionate nature of how this will overwhelmingly affect people of African descent. And some people may have taken that to read it as, this kind of competition. Oh, this affects us the most. But like, it's about advocating and calling this stuff out as harsh realities, not for sympathy. We don't need the sympathy, right? You know, because we've got we've learned how to encourage our own selves in the Lord. You know, we see that through the survey. But these are realities, and if there's ever a time that we need to be speaking, not just about how Black people are dying at disproportionate rates with COVID-19, but the other things that will affect. Because one of the things that comes to my mind is with so many other health-related issues, diabetes, hypertension, and things like that, and the pills and the things that many of us take just to manage our lives with that. Many of these things, and we don't talk about the pharmaceutical industry, actually don't balance well together, right? So just imagine having to take a diabetic pill, a blood pressure pill, and then get a vaccination or injection, you know, for this. And what are those effects, you know, that it has to the body? So we have much to be concerned about and much to advocate for. ADLA has worked closely with our EOCA advocacy office, trying to get more information about the effects of this. We've called the CDC and tried to get and to lobby them to pump up the information, which I do believe they have. I just believe that it's being suppressed. And so these are the kinds of things that we need to keep lifting up, because this is a marathon, and this is an opportunity for us to highlight and share the need, and to advocate and to make a difference and make a change in these things around us. Pastor Cheney, let's talk about our priorities, what people said that were necessary for our priorities as people of African descent, and where we may need to go from here and how it's affecting us.
So we asked our survey participants what was the greatest priority for their congregation right now. And again, we're speaking 4 weeks ago as far as when most of the respondents took the survey. And there were two major themes that emerged. One was communicating messages of faith and hope in the midst of crisis. And the other was updating technology for streaming service and online giving. So we've talked some about the technology piece already. That will continue to be a theme. The focus has really been on finding new ways to connect, to be a faith presence. We then asked about staffing decisions. We asked both for lay staff and for pastoral staff. And in asking about what are some of the decisions that the congregation has had to make. With lay staff, most indicated that there was no change as of that time, but where there was change, the change was in a reduction in staff hours. For pastoral staff, more than half said no change, but again, where there was change, it was a reduction of paid hours. It's interesting to note here the language that it's not hours worked, it is paid hours. But I think it's true both for our lay and our pastoral staff that so many people have been involved in figuring out how to, connecting back with the first slide of the greatest priority, how to translate to a technological platform for sharing messages of hope and faith, that there's been plenty of work done. The question is, how is that relating into the ability to pay for that particular work that is being done? And again, valuing not just our pastoral staff, but also administrative staff as well.
So when we begin to look at our congregations, and we estimate that there are about 500 or so total congregations that have at least 10% people of African descent, and generally about 155 or so that we would consider predominantly churches of African descent spread across this country in all the particular major urban centers or major larger cities within these yet to be United States. Amsalu, I'm on the impression as a director for Evangelical Mission, and that's why I'm kind of coming to you now, that many of our congregations already had some pre-existing conditions. They were struggling in financial ways, although giving at disproportionate ways, and we'll talk about that a little bit later. But because of white flight, they end up inheriting an albatross of a building that is in disrepair. When we looked at the responses to lay staffing and professional staffing or clergy staffing, the reality is most of them are solo staffed, right? So they don't have the option of laying off staff. If you're going to lay off anybody, it's the pastor, right? Because that is usually that person there, and that person generally is not full-time. Or as we talk about meeting Senate guidelines, which are minimum pay requirements that on average, the majority population receives more above than we actually receive as people of African descent or people of color, less than. So how can we, Amsalu, prepare now to grow ministry and meet the needs of this present age?
I think you hit the point by saying that it pre-existing conditions. As you said, the building, financial status, and all those things that most of our pastors or congregations are not paying their staff at the guidelines out there, and or some of them are actually doing paying some of their expenses through the grants that are available to them. So from the beginning, they are at a disadvantage point, but congregations are doing so many creative works. So what I just wanted to highlight, not only the negative that is out there, but also what they are doing. Some of them are collaborating rather than being in a silo and doing things as, this is my territory, my own, but they are collaborating and doing some works together. So which will prepare us to, maybe there are things that we can do, sharing the stuff or sharing the resources, the know-how. The second thing that we need to look into is the power of laity and deploying the resources that that we have in congregations. For example, we have many technology experts in our congregation, people who are media savvy in our congregations, who can flip their phone and do live stream the services, or maybe even connect us from our home to the digital world and stream our services. So those who are editing and all sorts of things. So how are we best use of those resources that are already in the congregation? These are the examples that we are lifting up now because of the crisis we are in. But what are the things that what are the gifts that are already in our congregations that we are not using? Not because it doesn't fit what we said, this is how the church is done in a traditional sense. Most congregations or churches out there globally are using the growing because of the ministry of the laity. So how can we deploy that in our congregations? That is one thing that we can prepare for. In the meantime, though, I think we encourage our congregations to take advantage of resources that are available. There are federal resources for PPP. There is the state resources, local, county, or city, wherever we are. There are resources that are available from the government. There are also synodical and church-wide resources, especially for this time. So if we are in need of, which our congregations already are in need of, but now more so, and the larger church is also providing resources and paying attention to our needs. So I think congregations should look into those resources and use that so that we can be even more prepared for the ministry that we are doing now, but also for the ministry we will be doing after this pandemic is over.
I think that's very important. I'm a firm believer that where there's vision, there's always provision. So when we talk about these greater priorities and the purpose, which you talked about and lifted up, seizing some of these opportunities. So I think now more than ever, one of the things that I could see many of the churches of color and all churches, every pastor needs a therapist and a coach. Like, so somebody to sit there and depress all the stuff that we deal with in our own personal stuff, but also one who can guide us, to push us, to organize our lives and our missions and our ministries to be more effective. The other thing that I wanted to say as you were talking about is we have to do things differently and not alone. And I believe that more than ever, we're going to find out now, and these are relationships that need to be engaged now. And hopefully they were engaged before with our ecumenical partners and with our church's effort to deepen relationships with historically Black churches. When I think of, I'm here in New York, again, in Harlem, we have one of our oldest Black Lutheran churches, the former Transfiguration Church, Christ, now called Christ Center, and was developed as a new start. And I think now is a time more than ever that churches that are fledgling like that would yoke and begin to make stronger connection with our ecumenical partners, realizing that we don't have to do this alone. And it may come to a resource redistribution that would allow both of us to come together, or multiple amounts of us to come together, so that we can become stronger and serve the greatest need. So I think those are things that we're going to have to clearly look at and articulate. The thing that concerns me, though, is if because of some of those pre-existing conditions, if some of these churches don't make it, I'm very concerned about how those resources will then be reinvested in communities of African descent. I have seen far too many times when synods, not just in Metro New York or New England Center or other areas, and I call them because I know them, is the fact is that they have used resources and have amassed resources off of the backs and the benefit of selling property and other things that predominantly have come out of communities of color. Disproportionately, they've engaged that. So that's a concern that I have, and as ADLA president, will be watching and after this pandemic surmises or comes down some. Ulysses, we have a church culture in the ELCA, particularly of professionalizing ministers. I don't know why we have it, because deep in our DNA as Lutherans, we believe in the priesthood of all believers. So I don't get how we became a church that professionalized ministry. I mean, we got lazy somewhere in time and history, and we became this us and them kind of thing. But How should lay people be preparing and sharing gifts in this age?
Sure. So I'll speak from my personal perspective as a lay person who serves as a leader in a church that does not have a pastor, in an African descent church that is not fledgling, but is definitely considering other models to sustain for the foreseeable future as we engage a membership that is aging, membership that is quite frankly dying, and a membership that is not birthing new membership. I've been fortunate enough to be affirmed in my leadership as a lay person, to where my gifts are not only used, but my ideas are heard and valued and even implemented. I don't know that that's the case in many of our churches. We like to exploit the gifts of youth, but we don't necessarily allow young people to operate outside of the gifts that we only deem valuable to our ministries.
Okay.
We have a lot to offer, and I benefit from a fellowship that allows me to give everything that I can offer. And I believe one of the reasons why we've been able to sustain not one, but two departures of pastors in the last 5 years is because of a congregation that has leaned into allowing lay people with gifts to serve fully in their gift without the pressure of formalizing the call, forcing people into seminary and these other things. And so I think, we are a generation of freedoms. And we are a generation outside of the box. And I think we exist in a faith model that has very much so been boxed. And not just in our confession, but in Christianity as a whole. And I think that as we can begin to tear up the box, if you will, we will see the reimagining of some of our faith houses in such a way that allows them to sustain in a 21st century while still operating on a first century theology. And so, it's a matter of not them and us, but we, right? And understanding that there's wisdom in age, but there's also some wisdom in youth, and being able to affirm that, I think, is what gets young people back into our church houses. And I say back into our church houses and not back into the faith, because we haven't lost faith. I think that's a misnomer, because we don't go into faith houses that we don't have faith. We've just found faith in other places that more so align with our sensibilities as millennials or Generation X. And so it's really I think COVID-19 has presented a teachable moment, where in which we were all forced to reimagine ministry in a new way, a way in which perhaps is more suitable to the gifts of young people than our elders. And in doing so, it has allowed us to relent to some practices that maybe the church wasn't otherwise open to. And I think that that's a good thing. I just hope that we maintain that flexibility, that agility when we come out of this.
I think what you bring, this affirmation of laity, There has been studies, Pew studies, Lilly studies about the dissonance within the clergy community, and many of them are leaving faster than ever. And I think we should pay attention to that. But I also don't think that we should ignore what's going on with our lay community, the laity, because particularly many of the, historically, especially for people of African descent, lay people have had this opportunity to be leaders and to learn how to be leaders within their communities and congregations by working and serving in ministry and church. And that should be affirmed in various ways. So I do encourage that. When we look across the board, many of the fastest growing church and Black church in particular, and one of the fastest growing churches in America is still the Church of God in Christ, right? And there are other churches, the historically Methodist churches, AME Zion churches, where many of the leaders have had to become bivocational in order to do ministry. Like they started out that way. They started out working at the plant somewhere and became pastor in that community and kept on doing that for many, many years until ministry grew to a point that it was able to host and support a full-time leader, or ministry became necessary for that. And many end up staying in that capacity. It's a little bit the opposite in our community, where the expectation is that the minister, rostered leader is full-time, he or she, has full benefits and will spend an enormous amount of time operating and leading the church. Reverend Cheney, do you encourage more bivocational ministry as a way to promote sustainability? Because that may be the real option that we need to look at. And again, it's working in other churches who are growing.
In fact, I do. As a mission developer, Gathered by Grace, the ministry I have the privilege of serving is intentionally one that was formed with a mission developer who is bivocational. When I had the opportunity to come back to Montgomery to explore ministry, the part of the model for how this ministry has formed has been with me as a part-time mission developer and part-time serving in a healthcare context, as I mentioned earlier. It has caused a different kind of a lessened budgetary pressure on the mission development. There are some things that we have been able to grow and to form and to explore that has been done in a way that is very different than one that has to hold the full weight of salary and benefits for myself. And so with that, it has been a privilege for me. It is a privilege for me to be able to serve in a way that allows me to be bivocational. Personally, it allows me to be able to use a wide variety of gifts. I believe God has called me to all the ways that I get to serve, which now I use multi-vocational because it seems to be growing every day. But with that, I am getting to use a variety of different kinds of gifts to serve the church and the community. Now, I'm very intentional to say that in many ways, my bivocational context is the exception, not the rule. Because I'm a second careerist, I returned to a first career when I came back here to Montgomery. What that means is that I have a sustainable second career. For so many people so many pastors that consider bivocational ministry, it's not necessarily a sustainable second job. And that can be very, very hard if it's just a means of earning a little extra income. Part of the reason why it's difficult is because of realistic expectations. The other thing unique about my setting is because I was a developer forming ministry from scratch, it meant I had the opportunity to shape the culture of this ministry. Gathered by Grace has never had a full-time pastor. This ministry does not know what that looks like because it's never been a part of the shape of this ministry. Conversely, if I were in an established congregation where I had been full-time and then the intent was to shift to bivocational part-time ministry, now we have to start talking about expectations. It means that you're not able to be present in all the ways and spaces that you have been before if you go from full-time to part-time. So I do think bivocational is an important model to talk about when we talk about the health of our churches and of our leaders, but I think it's important when we do so that we set realistic expectations. In the last 4.5 years or so that I've served in this context where I've been bivocational, I probably have said no more than anything that I've in any other time in my career. Because in order for it to balance, there are plenty of great things that I had turned down a writing opportunity last week just because I don't have the capacity, particularly in the midst of COVID-19, to be able to think about what it means to be a healthcare leader and what it means to be a pastor and to do it all. I have to say no. I have to think about those kinds of things. Well, what does that mean during that time when the congregation desires for me to be present in a particular way, if we're thinking through a traditional congregational lens, but there's a schedule at a job that says you're working on Friday from 8 to 5, whatever the case may be. So I am always hesitant, I've written about this before, that in the same way that I encourage bivocational ministry, it's something that we should think about. I'm also very careful to say that when we do that, we need to do that with realistic expectations.
And I just wanted to kind of add 2 observations on those topics that we have been discussing. As a church also, as a larger church, we need to talk about leadership development for lay, what it looks like. And because it is good to affirm leaders in our congregation, but there is also, we have to talk or maybe have some system to equip leaders to do and fulfill the call. The other, along that line, what Pastor Chen is saying about the bivocational. So
now,
that
multivocational.
Multivocational. Okay, all right. There is expectation from the congregation, but there is also, as a director for evangelical mission, there is expectation from the synodical part of it, from the church-wide part of it. So I mean, it doesn't. There are things that doesn't fit the system. Mm-hmm. So we have to talk about those and come up with, here are the things that, I mean, the things we should or shouldn't do when we talk about bivocational. We have to address that so that we don't overburden, and we say that so-and-so is bivocational or multivocational, but also expect the same kind of report, the same kind of expectation from the person also, because that will, I mean, or the congregation for that matter.
That's so true. There's really no such thing as a part-time pastor. That I've never understood what that even looks like. Even now, would you just quickly say, we're going to get ready to go to our next slide, but even now, would you all say that, you know, people are talking about board, I'm in the house, board in the house, and like I feel like I'm doing way much more work than it was when I was in my normal routine. Like I have been on.
I just want one board at a time.
Right. I am not more. I am more. I'm sleeping better because like it's wearing me out. Like I am worn out, and you talk about what, and I hear what you're talking about actually, because as Pastor Cheney had to learn to say no. I'm this week practicing. I got my passion planner and I'm ready to say no to meetings. I'm on like 6 to 7 Zoom calls a day. I can't sit up there. I mean, this call is about to end shortly because I'm getting worn out. But that's the reality. I feel like I'm working more. Would you all say the same? Yeah.
Absolutely.
I would say that. And that was part of the reason why in that last slide that I reviewed, that I was intentional to acknowledge that it's a difference in paid work hours and actual work hours. Just because everybody's not being paid for the same amount of hours does not mean that people are working fewer hours.
Right. And just before we go to the next, the thing about the lay part, that includes like musicians, the lay staff workers, musicians, sextons, and all that. Now, it concerns me most because when we talk about going back or whatever we go to, whether those people will still be around or have made other shifts, and those are critical, those are essential workers, ministry workers to the church. You can't have a church of African descent and don't have a good musician. Right, or multiple musicians. I mean, that's necessary. There's no such thing as having an a cappella worship service. I mean, we do our hand clapping and foot stomping, but we need that Hammond B3 or that piano or banjo or something going to do ministry. So how we take care and how we're prepared to take care of those leaders, those staff members is also very important. And then think of our sextons too, who are going to have to learn a different set of skill with a little bit more elbow grease, I guess, or whatever, and cleaning differently. And the cost of certain types of chemicals and stuff that will make our churches safe for us matters to us in ways that we have to pay attention to. So we've got to look at the staffing models for our future, not just for clergy, but also for other leaders